Hey everyone, welcome back, or welcome to, the very first episode of Cancer's Casket. I thought I should make the very first episode more of an introduction of sorts, and kind of explain what's going on. And for today's episode, I wanted to talk a bit about my specific kind of cancer, and what that whole deal means. Now you might be wondering how such a good looking guy like myself could get cancer. And while I appreciate the compliment, unless you're exposed to radiation, chemicals, or just have poor health, cancer really doesn't have a solid cause other than it just being genetic. Now, in my case, I was diagnosed with leukemia. Now, before I go ahead and explain a few of the differences between leukemia and other types of cancer, like tumor cancers, I should probably explain what leukemia is first. Leukemia is a type of cancer that starts in the bone marrow, which then spreads to the bloodstream, where it then creates a bunch of decoy white blood cells that ignore or just flat out can't fight infection, where over time these blasts, yes, that's actually what they're called, also begin to crowd the bloodstream, making it hard for bone marrow to make good cells and almost impossible for the good cells to do their job once they get into the stream. In other words, it's like an honest person trying to get into politics. Another way of looking at it is by how fast it spreads, or speed, and the cells that are affected. For speed, there tends to be two different scenarios. There's acute, which decides to show up randomly and decides to run an any percent speed run on how fast they can become pests and make the other good cells go away. Then there's also chronic. Chronic decides to take its time, paces itself out, and decides to give the other cells a bit of a break until they become mature. And for cell types, there's also two common scenarios. Lymphocytic, that targets the lymphoid cells, which once mature, become white blood cells for the immune system. Then there's also myeloid, which attacks the myeloid cells that later become pretty much any cell in the bloodstream: red, white, and platelets. With leukemia, there are often four types that will show up. There's ALL, acute lymphoblastic leukemia, which is the one I have. Then there's also AML, CLL, and CML. I'll put a description of what those are kind of on here. Now, with that being said, I can only really speak about the one that I have, ALL, because no two patients are going to have the same treatment. So that's kind of as far as I'll go with that. However, there are some common factors that differ leukemia as a whole to other types of cancers. Most other cancers have a physical spot where it's located. Basically, it's localized to a single area, like a tumor. But since leukemia is in the blood, you could pretty much name any part of the body, and if blood is present, then it could be there. Which also means I don't get radiation therapy, since if I did, my whole body would have to be radiated, which isn't the greatest idea. But instead, I get a different, fun little procedure, which I'll go over in detail in a different video. But I find the most interesting difference is how it's measured. Typically, cancer is measured by stages, 1 through 4, depending on size and how much it's spread. But with leukemia, since there's no physical growth to measure, what they'll often do is just a bunch of frequent blood draws and blood tests that check for cell counts and progression. Now, going back to me specifically, another classification that they'll give for leukemia patients is either low, medium, or high. I was given the high risk, which is mostly determined by health and age. And since with ALL, the older you get, the higher risk you are. Alright, and with that, we've reached the end of this week's episode. I hope I was able to teach you something new, and until next time, keep living.